Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy, where we rehab your mind to revive your body. Today we have a special treat for you all. We'll be showing you our behind the scenes magic in full treatment form with a friend of mine, Albert, who has had a series of knee injuries that could be severe or not. But first, please spend a few seconds to like our video, subscribe to our channel. If you found this video helpful in any way, please consider hitting the thanks button and donating. We appreciate your support.
My name's Albert. I am coming in for right knee pain and a lack of mobility in the right knee. Back in February 2020, I was playing basketball. I pivoted non-contact and I heard a pop, and I tore my lateral right meniscus, and it swelled up for a couple months. And then during COVID, we couldn't go anywhere, so the swelling decreased. And then I've been playing basketball for about a year since COVID, and haven't had any injuries until about 2 months ago. I didn't hear any pops, but what happened was my knee swelled up on top of the knee and in the back of the knee where I couldn't bend my knee more than 90 degrees. Current symptoms, yesterday I tried doing a conventional deadlift, and at the bottom of the movement, I felt a sharp pain right under the vastus lateralis, the quad muscle. If I do a standing quad stretch, I can feel tightness within the joint, and then if I sit for extended periods of time, when I stand up, the back part of my knee feels extremely tight and I limp a little bit until it warms up. My doctor said if I can walk and run without pain, don't need the surgery, just because sometimes they go in there blindly and it might take a couple procedures to actually get it fixed. And so if I'm not playing basketball, I can run fine, I can run miles, sprint, no problem. And it won't swell up if I do those activities. It's the quick movements, the pivoting, external contact where there's external loads on top of my own body weight that sometimes can inflict swelling. I've been doing a lot of hip strengthening exercises, some physical therapy exercises to prevent further muscular atrophy in my right quad and my right hamstring. It has helped, but it's still not there yet. Like, I was sitting yesterday playing Halo for about 2 hours, and when I got up, I was limping around the house until about maybe 2 minutes later. Then the pain went away. I know I need further care, further treatment, I want to get back on the court as soon as possible.
All right, we're gonna move on to range of motion testing to see what Albert's numbers are and what it reveals, whether it's in that normal range or something we need to focus on for treatment. All right, Albert, so I think you're already in this position. So we put you these blocks here. We're just gonna check extension. Ideally, extension is 0. So we got that in the middle, and yes, I do range of, but you have a little bit of this extended or riccobartum. It's like 5 degrees, and that's still within that normal range, but could be one of the reasons you got some instability there. I'm gonna check both sides, but since I'm on this side already, let's go ahead and check his knee flexion. And that's about, looks like, I don't want to force it more than what it is, but so we got that here, we got these landmarks here, and it's about 115. Ideally, I'm looking for a little bit more like 130, 135. And then since we have him in this hip flex position here, we're just going to move up the chain. All right, I'm going to throw that right in the middle here. Ideally, this is also, where is he at right now? We're sitting around also about 115. We want a little bit more, and it's a little stiff, guys. You can really see that. A little stiffer. So ideally we're looking at about another 130, 135. So we're going to flip over to this side. That way we have some normals. So check this out here. And is always run from a place if they don't check both sides. That's what I always tell people. But yep, about 5 degrees here. So that's normal on both sides. And let's see what his knee flexion reveals. And that already feels different. It's a little bit more springy, and we like that. So we got here for Albert here, we're already at about that 135, give or take where I put my landmarks, but 135, that's where we got that. So that's about 20 degrees difference. And since we got hip flexion here, I can tell you that feels a lot looser too. So all these three realms, just like I showed in previous testing, right here, so that he had some dysfunction there. So, yep, perfect. We're at that 130. Bam, right there. So, 130. There we go. So, that's something we want to focus on in our treatment. That's something I'm thinking about when we're going to provide care for Albert. All right, so Albert also talked about in his subjective portion that he felt a pop. And so whether it was the meniscus or the ACL or any of the ligaments, we do want to be concerned about it. So we want to do some more further testing. So we're going to drive your right leg here, Albert, and just tell me if there's any pain, anything feeling weird. So just relax. This is the anterior drawer. If it's loose, there's a good chance that. So right now, it feels pretty good. And then let's just kind of check that out for this direction here. I have to prop that. Actually, this has a little bit more laxity, so this is a little bit more maybe PCO. So there's a little something here, and then I can check some other ligaments like the MCL and drive that through and some other tests here.
I sprained my PCL before.
Yeah, so the PCL might have been something when he was cutting. Could be the reason. So we'll check the other side. So I'm gonna flip flop sides here. And we'll do this same test here. So get that. It's stiff. It's good. Just like the other side. Just kind of test him here. And yeah, this is way better. That's what it should look like. I know it doesn't seem like much to you guys at home, but that compared to here, so we'll just kind of, you can see that right here, because just focus here. There's a lot of give. You can see even this little thing popping up here. And so that could be some of the ligamentous laxity or damage that he may have occurred. So right here, that's that. So, and then just kind of just testing all these other ones. They should be fine. Yep, pretty good. All right, everyone. So we got some great information from those tests previously. Now we're gonna move towards treatment. I don't know if Albert's ready for it, but he generally is game for the treatment. Sometimes it's painful, so if he grimaces, that's okay. We're trying to get results. So we're gonna make some big changes today, and then we'll retest those tests again and see what improves. All right, so we saw earlier that he had some missing hip flexion, and so we wanna get that back. Other things that can affect his hip is internal rotation, but I know I worked on him about 5-6 weeks ago, and that was something that we need to improve. Still needs a little bit, so we can do some soft tissue stuff, and I can do a little bit of that and see if that kind of gets a little bit better. But we can do some of this stuff here. Just a little strumming here from the Institute of Physical Art. Great manual therapy courses there that I've learned. Not being paid by them, just wanted to give credit where credit's due. Okay, good. So that doesn't take long, and we already have a little bit more range. It moves fast here. Once you got the right results, I got some other torture tools I like to use. Save my fingers. So there's a little spot here. What I notice right here just doesn't move a whole lot, and we can see if it helps his hip flexion. He's allowed to grimace. It's okay. You don't have to be tough, buddy. But yeah, sorry. Let's do here, and I can tell you already, this looks already different. And feels different. It's a little bit more springy. But I can also feel that there's something caught right here. Very important structure right here. There's a lot of people who get hernias, inguinal ligament right here. So if I compare both sides, this moves nice. This over here, probably tender. Over. Yep. Just give me feedback, buddy. So, I'm gonna get a different tool here. Right here, get right in here, and then I like to add a little bit of movement here. So you're gonna go side to side for me. I'm gonna get right in here. Yep. We can work through clothes, and that's the great thing about great manual therapists. They don't need that skin on skin. Sometimes it's actually better to have clothes to protect our clients here. You doing good? Yeah, happy, right? That's good. Good. All right, so let's check that again. It looks like I enjoy this stuff, and I do, because not that I want to give pain to people, but I like getting results. It's like popping blackheads or something like that, so satisfying. All right, so there we go. Now I got this belt on me. Looked like Rambo for a second, but all right. I want to throw this here for a good hip capsule mobilization. We're moving fast, like I said. The devil's in the details, and a lot of it is about the assessment. That's why we spent actually quite a bit of time on this video, filming and showing you guys the right angles. So right here, Albert, don't let me move you. Hold. Right here, take a break. Good. And I like to share that everything's square peg, square hole. If you got the right treatment, and you got the right analysis, that action happens so nicely. Good. All right, so that was just treating his hip. My whole dissertation in the past was actually about treating people's hip to help the knees. So I haven't published it, and I don't think I ever will, but let's take a look at that knee flexion again, and look at that drop. You know, let me go grab my handy dandy. But I didn't even touch his knee. I want you guys to notice that, right? He was at what, 115 earlier. Now he's close to, we got about, good 9 more degrees. 9 more is 124. And so compared to his other side, that 135, 140 where he could be, sometimes the error about 5 degrees. So let's go move on here. So this is improved. I like that. We're gonna move on to his ankle. I'm actually gonna take this one from you. Go ahead and bend. Good. And so let's just take a quick look. I didn't check his dorsiflexion earlier, but let's take a look on this side. Just a little bit different, a little stiffer on this side. Subtle to most of you guys, but here, let me put this over here. But, yeah, just, you can tell this one comes back just a little bit, maybe 5 degrees. So just 5 degrees, something stiff here. So go ahead and bend this one. All right. Good. Right over here. And what I'm gonna do next here is I'm gonna actually use a couple tools here. I'm gonna grab some grip, just dice him here. My favorite. I'm gonna block him. It's a little technique I created here to create some derotation. I saw a lot of that in the ladder drill, his running, his walking, his mini squat, where that thing came right out, right? It came and bowed right out. So we want to start making those changes here. So I'm gonna block you here, Albert. Go ahead and just bend your knee and straighten your knee. And I'm gonna block here too. So I'm gonna drive his heel down. I call this an ankle heel, or sorry, calcaneus decompression. And it really starts squaring and aligning people's ankles. A lot of this could be his driver. There's a lot of tests to kind of tell us quickly as manual therapists what helps. So now I'm gonna take that here and block him here. Now, go ahead, bend your knee, straighten, bend, straighten, bend, straighten, bend, straighten. Yep, painful, right? Ankles, in this clinic, the ankle's the second most painful thing that we do. First being the TMJ jaw. The collarbone, clavicles, usually the third most painful. So good. I'm starting to feel this loosen a little bit more, which is great. Put that here for now, and let's see if it's starting to align a little bit more, and it does feel a little bit better. There's still some restriction here. If we want to take a look, it doesn't lengthen. If we gotta take a close-up here, you can see it doesn't lengthen. Unlike this side looks a little better. That's what lengthening looks like, guys. To tendon, Achilles tendon, super important. So that's something maybe we prescribe in his exercises. So these are stuff when you're looking at manual therapy, or some of you PT students or professionals out there, you're seeing things like, well, what kind of exercises can I start providing from the stuff that I learned or learned in the treatment? That's what great therapists do. They're great at prescribing. So we're gonna work on this. I'm gonna free this puppy up for Albert, and he's gonna love it. Right there's a snag. This could be a nerve here. So I'm gonna get right in there and free that up. Yes, good. All right, very enjoyable. Wow, that looks night and day different. Actually, it might even be better than the other side. So let's take a look. Do you see that, everyone? We can spend some time on a future visit for the left, but that is different. That's some changes. We love changes. Like I said, It's like popping blackheads. Or since I got all these white hairs, it's like pulling white hairs, some of you. So I didn't even touch his knee yet, right? That's the crazy thing. So drop this leg, bud. Yep. I haven't touched his knee at all. This is so cool. Look at this. All right, I'm gonna take a measurement. All right, we're watching these changes go, and I want you guys to see that. You know, this is beauty. It's just look at that. That's like one. That's another. I don't even know. I can't even do my math right now, but it's pretty exciting. It's about 128 right now, everyone. I'm not even forcing that a little bit, but how's that feel to you, bud?
Yeah, it feels looser.
Looser,
like
right?
More relaxed, yeah.
Does it feel like a little bit more aligned?
More range of motion.
More range of motion, yeah. So that's good. You know, that's something. Range is something that's important for us because it helps give us the ability to have some function. So let's check this one earlier. Well, I forgot where we were at, but
115.
115, right? So, you know, that's already right here. He's already at like 120. 124 is where we have that. So of course we can do a little bit more, but you can see that these are starting to make some changes. All right, so we've got that. Now we can start focusing on the knee itself. But before that, there's important stuff. There's structures around the knee. This is the fibular head. This is the fat pad, and you can even tell between the two fat pads, this one's a little bit more puffy. I should have done, I apologize, a girth thing, girth measurement, but I think you guys can tell it's different. So just take a quick, you know, this one's maybe a little bit more tan too. Just maybe more sun on this side, but right over here. So we're gonna go right into this here. So I like this little position where I actually block him, and then I'm gonna drive this fibular head back. All right, go for it. And I'm gonna take this tool. Okay, go ahead and bend your knee. And the cool thing is, if you guys are watching here too, I'm also driving my heel of my hand into his inside ankle, and that's gonna help him a little bit more. Good. Knowing very well that there's some laxity from his posterior drawer test. Good. We want to be cognizant that sometimes when this is off, that puts a lot of strain on people back here. Have you had pain back here?
Yeah.
Yeah.
When after sitting down for about an hour or two.
That's when you feel it. Yeah. So actually, sometimes that is something when people feel it in the back here. Everyone, we're gonna take a look. You might have felt this pain. Everyone thinks you're cuckoo for Cocoa Puffs, but this is actually, there's some nerves that go back here. There's a lot of laxity. The driver of that pain is this guy, this fibular head. So we're going to work on that, maybe a little bit more specifically, that with a little bit more of these details. So, you know, good manual therapists, just keep going through the investigation. The clues, there's a lot of clues that get provided to us during that time. So go ahead and bend your knee, straighten it, bend it. And so we get clues, we keep adding that up. Clues. More clues, the better. That just makes it better for us. And it's getting a little looser, and now I want to drive it down. Good, good. And down, up and down. Good. There, good. And I can put a little pressure here as well. Good. I always tell my PT students that you better know where your hands are. If they have no business touching a spot, then it shouldn't be there. But you should always have intention. Go ahead and bend your knee. Oh, yeah, there you go. And then, good. There you go. Now it's starting to go. Good. Take a little break. And that was just working on the fibular head alone. But let's check the range. Why not? Let's see if it's continually improving. Oh, man. It gets out of the way. This whole thing isn't blocked back here anymore where it's like sandwiched. It's a little bit better. Let's see where we are here. Are we getting closer to that other side? Are we closer to the measurements? You know, on this other side here. Yeah, look at that. I still haven't really worked on his knee joint. This is kind of this outside knee joint. There's actually 3 joints around the knee, but that I barely even needed to touch, and you know, which is good. You know, when we were evaluating, I kind of knew it was a little bit more mechanical. Some of the stuff, if we shot this, you know, a few weeks back, Could have been a little different, but this is the progression of these treatments. So I'm just gonna kind of see if I can get this a little bit more stable. And right now you can kind of see that it's like that, everyone. And if I can try to just 1 millimeter or 2 millimeters in, his life's gonna get a lot better. He's gonna do better on those ladder drills and squats. So deadlifts as well, some of his goals. So I'm gonna do that here. I'm gonna drive this. Go ahead and bend your knee and straighten. So just kind of continue a little bit of that. I'm putting pressure from here. And guys, if you, yep, there we go. And so I'm putting him out here on purpose, just slightly rotated, so I can drive his ankle in a little bit more, because that's when cutting, this is what happens. This goes out, this goes in, especially when he wants to cut left. And maybe that's, Albert, is that what direction?
I'd like to.
Yes, he likes to cut left when he drives to the hoop. So that could be one of the major things. So maybe he has to learn to cut the other way, cut to the right. Good. But that, oh, look at that. That's already, I don't know if you guys can see that. We'll do another shot. It's already starting to straighten out a little bit more. We have another technique coming up in a second, but we'll have to change positions. But that is looking real good. So what I feel now is, now that I actually put this in the right place for Albert, I don't, if we film here, you can see that actually it does kind of look stiffer only in this area. This is a kneecap. So this is the other joint that people forget about, this fat pad we talked about. So we're gonna actually put him in this position, and I'm gonna work on that fat pad here. A couple tools here, so. Good. We're gonna drive through that. I'm just gonna try to carve out that kneecap for him. And good. Oh, that's a good one right here. Tender here?
Yeah.
Oh yeah, that's a good spot. A lot of people, when they have knee injuries, they'll feel like they hurt something here. There's some small ligaments that kind of hold up. They're kind of like train tracks here, these little radial fibers of the meniscus, and people actually can get the pop, and it could be those things that are disrupted. So there's a good chance that Albert actually disrupted these as well. It doesn't show up on that Thessaly's test, so I found that sometimes it's just by pure touch. But let's start freeing that up a little bit more. He loves me for this. Good, good. Yep. Little catch there. Good. And then, oh, there's a nerve here that goes across here as well, saphenous nerve. We want to clear that out of the way. Yep. You sweating, bro?
I'm sweating.
This is good. This is good.
A lot of pain.
Lots of pain. But it's good. I actually know him. So am I a little nicer to people I don't know? Yes. Am I a little meaner to people I mean, yes. So there's that nerve. I'm trying to get that. It's like popping the blackhead right there. Got it. Good. I can share stories about these torturous tools later on a different video, but where I found them, the origins of them, always great stories. So now I can actually focus back on his kneecap. Let's use my little Dysum. This little gives me grip since he's starting to sweat. It's harder for me to grip, but I'm gonna basically use my Vulcan grip here. Grab, actually maybe my left is better for this angle. So we're gonna grab that. I'm just gonna pinch and lift. By squeezing, it's lifting his kneecap. So I'm gonna go through here. Boom. And that's starting to open up even more. There we go. There we go. Alright, let's take a look here. Look at from the top view. Now that's starting to align a little bit more. And then the last sequence of techniques. But let's take a look at the range. Let's see, everyone, if relax here. Good. Yeah, look here. We're already starting at that 130, but now if I do a little bit of that extra range pressure, we're getting a 135. That's beautiful. Let's compare it to the other side. quickly. Good. Well, now it's a little bit more even, right? I can tell you. Yep. Yep, there it is, 135. Good, so I would say that's pretty good for a day's treatment. Of course, there's other stuff to do. We're going to talk about exercises in another clip. All right, so you can see here, everyone, Albert, and the reason, even though he had an injury on this side before, this looks relatively good. If I drew like that line, you can imagine how that collapses nicely like a jackknife or a Swiss Army knife. But if you look at this one here, everyone, and you draw a line here, this is, before it was kind of kinked out here, we made that a little bit better. But if you take that line and I just did this to it, so it's a little bit of just kind of using our eyes, using our feel, using our eyes. Very different. So subtle. I get a lot of information, and a lot of that compression is sitting right here for him, right? So, all right. So, okay. So what I'm going to do is we're going to set him up. We're actually set him up on his side, and I'm going to actually start putting a lot of force through here. This is inspired by my mentors over at the Institute, and I think this is a great technique that we're just trying to shear it down and really get it a little bit more aligned. All right, Albert, I'm going to have you lie on your side.
Which side?
Your left, please. Yeah, look at that sweat here.
Yeah, I'm sweating.
Everyone, look at this.
It was painful.
Good. This is the real stuff.
It was painful, man.
There's no acting.
Painful.
All right, so you're gonna lie that way, Albert. And then you're gonna bend the bottom leg for me.
Just like this, right?
Yeah, yep. Bend that all the way up. Like tuck it, tuck it, tuck it, tuck it all the way up.
Okay.
And since I got this here, you can tell here, right here. So remember, everyone, I'm trying to physically drive this bone down 1 to 2 millimeters. Doesn't seem like much, but it's gonna make a world of difference on his tests and when we perform those other ones. So, good. Good. All right. So as soon as I do this, that fibular head pops up again too. So right here, everyone, if I flex him, boy, that also, and to you guys, it's very small. Doesn't seem like much. To me, this is a lot of excursion, a lot of instability. So I'm gonna block him with my knee. I'm gonna block him with these, and then what you're gonna do here, Albert, is I'm just gonna shove. You're gonna bend your knee slightly, and then you're gonna straighten slowly. Does this hurt?
Just more on the pressure on the foremolar.
Oh, on the foremolar? Okay, yeah, on the adductor. Okay, go ahead and straighten though.
Or
straighten
actually
your
run the ankle.
Straighten your knee. Yeah, there we go. And then back off. Straighten your knee. And back off. And I'm going to put a little bit more pressure underneath here. And then back off. Good. Yes. Manual therapists aren't afraid of doing some elbow grease here. Oh, something just clicked actually. Even. Okay, go ahead and straighten. Let's just see if that feels different. Straighten. Just a little bit left. I think we got some of that slide about a millimeter already, so maybe there's just about half left. And that's like the devil's in the detail, but there we go. So let's flip you back on your back. Let's see if you start looking a little different. Good. All right, everyone. I think you guys can tell that it's starting to look a lot more aligned. Could he use a couple more repeated treatments where it's not, of course, some calf stuff? So we're going to talk about exercises next, and yeah, that's basically where we're at. So let's take a re-look at the range one more time. Good. Go ahead and bend. So a lot of this earlier, everyone, we kind of walked you through the process. Okay, good. Yep. It's probably going to be close to about the same since I really didn't change as much, but it's a little bit tighter in feeling because I pushed it a little bit more in the right range, but that's okay. Like I said, there's an error of about 5 degrees. So just some more of this. So sometimes as I shoved it in, I compressed here, so we're gonna see if this little decompression of his knee joint one more time, or kneecap, sorry, the kneecap. Really just gives us the range we want. So, like I said, these are just understanding. I'm putting them in different ranges. Good. And that just by creating a little bit more space here. What do we got? So, relax, let me have it. Yep. Yeah. Just a couple more degrees, getting closer to that 135, but you know, we'll do that as part of his exercises. So, good. All right, Albert, we're gonna move to the exercise portion of your care. I think because of the nature of all the things that were more mechanical in today's treatment, that's where we're gonna go. So we're gonna do two specific exercises. These exercises are also in greater detail for everyone, and we'll link those in the description below. We're gonna do kneecap decompression to give him a little bit more space because we've shoved everything in and compressed it a little bit in his knee as we made that shift, or that shearing shift. And then we want to give him a little bit more flexion, something to work with. So we have a great exercise, the boogie boarding, or knee gapping is what we call it as well. So, all right, so with this exercise, what you want to see, go ahead and grip this one here, Albert. And you want to grip it like the Vulcan grip, like a little claw game, and pull up, and then see how far your knee can go, just as relaxed, or sorry, your leg can go. And you can see that's pretty good here. All right, so let's do this on this side. Go ahead and grip that, and then see if that, it should be ideally the same, but you can see right about there gets tight. It's like half. It's literally half. So your exercise is to work in and out of that pressure. Do you feel pressure here in your kneecap and your grip? It's like sucking it down. It's almost like something is stuck. If this is the kneecap here, everyone, and he's doing this, it's sucking it down. And so his goal is to kind of pull those fascia, the tissue, the nerves up, and then work in that. Yep, keep doing that. Perfect. So just pressure on, pressure off. You can do this also sitting on a chair or a bus ride. Some of you who have more of this swelling in the knee, do this at the office. I used to do this at boring business meetings. Sorry to my old employers, but that's true. So I myself have ACL reconstruction, so some of you guys don't know that, and 2 meniscus tears as well. So because I was young and dumb and playing flag football, of course, you know, I'm not paid for that. So good. Now let's see that again. Let's retest. Grab that, yank that up, and then go ahead and let it bend and see where that goes now. And that's already made improvements, right? Just like in my our brief talking. So he'll continue to do that. You can do that a few times a day for just 1 or 2 minutes. And like I said, you can do it at the edge of a table or a chair, or at the gym, you know, when you're on the workout bench. Now we're gonna move to something called boogie boarding. So I'm gonna have you're gonna flip and you're gonna face this way, and you're gonna be kneeling. Okay, so yep. And go ahead, and we're gonna show everyone. Like I said, these exercises are more in depth where I talk about a little bit more. Today I'm just kind of speeding through it. But what we want to do is get a nice handy towel. That's why I had it on my lap. This is going to create that gapping for Albert. So Albert, you're going to pull this up and hold it here. Yep, both hands. Yep. And then what you're going to do here is basically you're going to, just like this, you're going to rock. You know, you're going to basically just, you're going to rock it kind of back and forth, right? And so the thicker the towel, the easier it is, everyone. But the thinner the towel is what we want to progress him to. So work that, and you should feel a little stretching here, this area, and that's usually good. If we did this to the other side, it would feel like nothing. We won't have to be doing that here, but now you can, once you're down here, Albert, you can go ahead and go side to side. Pressure on, pressure off. Now if we get a view of this here, you can see there's very little motion at his, it should go almost like this and this, right? This side looking good. Boom, boom, boom. But he needs to restore that if he wants to cut to the left more, right? Again, he's gonna have to get that pressure on. It's a little tighter going that way, right? Yeah, so when he goes that way, it's a little tighter, so he can work in and out of that. Go ahead and just work in and back to the middle, and then back out, in, out, yep. And you're gonna see, once it starts making that improvement, he's done with the exercise. And it could take 5 minutes, it could take 1 minute. Regardless, we're just trying to, now it's looking better. Is that feeling better?
Yeah, I have more range of motion.
Yes, you could tell he's getting a little more range. And as he gets more range, he's going to decrease the thickness of the towel. So go ahead and take that towel out and then just make it a little bit less thick. So yep, maybe like by, instead of folding by 3, it's just 1 fold here. Good. So do that same thing again. So like I said, you're gonna hold both ends and really he's trying to basically push it through and create that gapping with his own force, his body weight coming down, his arms pulling forward. Yep, good. And he's gonna try to get that gap. It feels like a good stretch, right?
Yeah.
Yeah, so this is really good stuff. Good. Now that's looking better. So that's already, everyone here, if we had some before and afters, but you can see now he's able to roll that way. Great exercise. Good. A little bit more. Good. And then you would thin that out again. Go ahead, thin that out one more time. 1 less fold, and that's what we'll end with. But we'll do this one. And like I said, eventually you just take the towel out, everyone. That's his goal. That's what he's going to work in, and he's going to feel a lot better. And then we're going to go into post-test, everyone, and really see if we make some changes. You know, maybe we'll do the ladder one. Also, I'll pick the mini squat one and the little impact one. We'll just do that at the very end, and then that's it for the day. Good. Yep. Awesome. Good. Good. Cool. All right, everyone. So we're gonna do some post-test, but I want to grab one final range here, and let's see how Albert is giving us any more of that range here. Got more of that back, so I'm blocking that here, and so we're getting, close to that 140, everyone. And that's good. I don't want to push him past that, but all right. So let's go ahead and we're gonna stand up and let's do some mini squat, and then. Alright, so everyone, let's do the mini squat up top, and then we'll come up closer and take a look here. And that's already looking a little bit better, where he's not deviating as much. Is that good? Are you trying to, is this more natural, or are you acting on camera?
No. I'm just moving.
It's a little bit more collapsing, like I said, like that Swiss Army knife, everyone. Good, so stay right there. Why don't we do this little test? Stand up, yep. Okay, so earlier we did this kind of pushing neuromuscular test. Left side still good, obviously, doesn't want to change, but let's see what happens here. So, much more sturdy. Do you feel a difference?
Yes.
Yeah, I don't know, everyone, if you can see that. That's a hell of a lot stronger when it's more aligned. We'll take a look at that side. Yeah, everyone. Like I almost have to take there. Yeah, it just looks more rooted and feels more rooted, not just look, but right there. And that's a good sign, that neuromuscular change, everyone. That's what we're looking for. And that's the key piece to healing, is that neuromuscular strength, that capacity coming back, that body awareness. This is huge stuff. We'll look at it again. Right there. Oh man, that's good. That feels really good, right?
Yeah, I feel more stable for sure.
That feels really good. Yeah, that's awesome.
I hope Albert's treatment was insightful in educating you all what happens in manual therapy clinics like Rehab and Revive. Let us know what you think. If you want more of this style in the future, leave us some love in the comments box below. Once again, please like and subscribe, and we appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.